I always tell my patients, the whole point of Botox is so you never make that wrinkle. Because once you etch a wrinkle in, it's very hard to get rid of.
I'm too late. It's time for us to
do some roasting.
Yeah, and figure out who has went under the needle and who has not.
I love her. I never want to say a bad thing about her. I love her, but bitch, please. Are you kidding me?
Because Botox, you don't have to dissolve. You just let it wear off. And it only takes you 4 months. It doesn't take years.
Hi there. Welcome to the Champagne Hour, where we talk about beauty secrets with a little bit of bubbly. I'm one of your hosts, Wealthy, and...
I'm BP.
I'm Pais.
And I'm Dr. Johnson Lee.
So, what are we talking about today? The whole idea behind this podcast is that there are so many things in the beauty industry, right? And even for myself, trying to figure out, what do I want to dabble in? What do I want to get done? I don't know what works. I'm talking to my friends. They don't know what works. So we decided that we wanted to come here and talk about it, and we're going to figure it out. So today, we're going to have a focus on Botox with Dr. Johnson Lee. And, we're going to be talking to him about that, some of the procedures that he does. And, I mean, I have a lot of questions because I've never had it. Have I thought about it? Yes, many times.
Do you need it? Maybe.
Maybe. Because maybe I won't have to use filters anymore. Exactly. You know what I mean? So, yeah, now we're going to figure it out. So
Dr. Johnson Lee, welcome to the show.
Hi, everybody. Thank you for having me.
It's great to have you. Now, I know you personally, and I know you have surgery or what's it called, an office?
I have a private practice.
Private practice in Beverly Hills.
Yes.
And you came wearing scrubs today.
I know. I just finished surgery. So
Was it a good surgery?
Yeah, I had a good morning of surgeries and came right over. I was afraid I wasn't going to make it, but it was good.
You just changed someone's life right before here.
I think I fixed them a little bit because they had surgery elsewhere with somebody else and they weren't happy with it. So I had to kind of correct some.
So it was a little bit of a botched situation.
Well, just like touch-up stuff.
Touch-ups.
Touch-up, yeah.
So we're happy to have you here today. We can talk a lot about Botox, which I personally have. I only just got Botox again last week for the first time in years. Because I wanted to be natural.
Wow.
But I did start.
You held out for a really long time.
I did. I wanted to see what I would look like as an adult, like natural. And it was cool, but then I got over it. But I did start Botox at 24, which is quite young. But I was told way back then, and I sort of believe this, and maybe you do too. So this is a question for you. Do you believe that Botox is a good way to prevent aging? Or?
Yeah, so I mean, honestly, I always tell my patients, especially first-time patients, that Botox is a preventative medication or treatment. So I don't, when patients come in, they're like, oh, well, I don't really need it. I'm just going to, it's starting to bother me in some photos or pictures, but I'm just going to wait until I really see like a wrinkle before I get it done. What's the point? But I always tell my patients, the whole point of Botox is so you never make that wrinkle. Because once you etch a wrinkle in, it's very hard to get rid of.
I'm too late.
Because I kind of say it's like having a fresh, your face is a fresh piece of paper. The second you fold it, no matter how many times you try to flatten it, you're gonna always kind of see where that crease was, where you folded it. So the whole point is to keep your skin or the paper from folding. And that's where Botox comes in.
So I had a lot of friends say to me as well, same thing. I'm not going to do it yet. I'm going to wait till I'm 40. I'll wait till I'm 50, and then I get a facelift. Or I'm going to get a filler, and I'm like...
That's a big job.
Just get a bit of Botox and paralyze for a minute, and then relax out the lines. Do you have people coming to you saying, oh, just give me some filler in my lines and make that work, or...
Yeah, so fillers and Botox are kind of in the category of injectables. So it's not surgery. We're not cutting you. We're not doing anything like that. You're not taking a pill or anything like that. It's just something that's injected into the skin. But they do different things. So Botox is injected directly into the muscles, mostly kind of in the upper face where you make wrinkles, you smile, you look angry, you raise your eyebrows, things like that. So it paralyzes the muscle so you cannot make those wrinkles. Filler doesn't do that. So filler directly fills any area. So if you have an existing line or a lot of people have like the tear troughs, the hollowing under the eyes, or the folds, the nasolabial folds, even the marionette lines. These are areas where you kind of have like a trench, like you have a depression on your face. That's what filler's for. So Botox is for paralyzing muscle so you don't make a wrinkle, and filler is for filling any depressions on your face.
And the time for the muscle being paralyzed can differ between person, right? Or should we expect 6 months of beautiful face? Or
Yeah, so generally speaking, for the current, and I have to say current because there's a new one that's coming out pretty soon that lasts longer than all the other ones. Okay. But the current ones, which have been around for over a decade, they last generally for first-time users about 3 to 4 months is what I see.
Oh wow!
Now, if you use Botox regularly, so I tell people it's like getting your hair colored or something. Like if you go back regularly to touch it up, then you only need to do it every 3 to 4 months. And the more you do it, some people extend out to 4 to 6 months. Because if you think about it, the Botox is paralyzing your muscle. And the longer you paralyze a muscle, the more it atrophies or the smaller it gets. So if you think of maybe somebody who had a traumatic accident and became a paraplegic, because they don't use their leg muscles anymore, the legs become skinny, the muscles atrophy. Mm-hmm. Same thing on the face. You don't use the muscles, they shrink. It takes much longer once they've shrunk to get back to their normal strength and size. So the longer or the more frequently you use Botox, the longer kind of each session can be spaced out.
And would you be scared of doing Botox because you're worried about, or are you scared of Botox? Or do you think that you're thinking, oh, I'm going to be paralyzed for 6 months. What if it doesn't look good? Or do people have those types of fears?
I'm scared of shooting
Needle.
something in
needle?
my face.
That's like that's the least.
Yeah,
thing
and then I
scared
see
about.
some ladies that look crazy.
Oh, yeah. Yeah.
But is that Botox that makes
Yeah,
them look
so
crazy?
a lot of
So I
people
don't
will say like,
know.
"Oh, I just got
Scary.
Botox,"
Yeah.
but they literally probably had like 10,000 other things done to their face.
Yeah.
But they just tell, "Oh, I just get Botox. That's all I get."
And then you're like,
Right.
and I'm like,
I don't wanna do
"No,
that."
I don't think so."
Well, but I wonder though, if you, let's say you go and you keep going, what happens if you just automatically stop? Like,
Okay,
do
so
you,
that's
like,
another one I get. Like people who are really
smushed?
scared, they think their body's gonna hypercompensate, and you're gonna it's like Dorian Gray, like they're gonna age like very rapidly. They're kind of like, God, if I use Botox, I'm gonna have to use it for the rest of my life, and it's just like this extra cost, and I'm gonna be hooked on it because my face is gonna melt afterwards. That's not true. Once you stop using the Botox, your muscles just reactivate, and it's kind of like it's like taking a break from the gym. You can take a day off or you could take a year off, but once you go back to the gym, you start shaping up again. So once your muscles wake up after the Botox and you decide to stop using it, you'll just start making those wrinkles again. The thing is, most people who do Botox really like it, right?
Sure.
Mm-hmm.
So you end up doing it for a while, and for some reason, maybe you having budget issues, maybe you are traveling and you don't have you're traveling for a long time and you don't have the ability to get your touch-ups. Then they all of a sudden say like, I aged, 3-5 years overnight once my Botox wore off. And I'm like, yeah, but you've been getting Botox for 5 years or 10 years.
I
So it's really
see.
just how you would
I see
normally
what you're
look
saying.
anyways. Yeah.
But Pais
I
had
have
a
a big question.
which I thought was pretty funny because I never even really thought about this.
Where does it go? Somebody told me, and this is not a valid source, but they're like, you just poop it out. And I'm like, well, where does it go? Does it dissolve? Does your body metabolize it?
Yeah,
Or-
it's a protein. So botulinum toxin, which is the ingredient to Botox or the other brands that are out there, it's a naturally occurring toxin that you can find out in nature. I mean, that's why they say you shouldn't eat expired cans of mushroom soup or mushrooms because it'll actually have natural Botox brewing in there.
Oh, so we can just go
gonna-
buy a bunch of
Yeah.
Or they even say so it's kind of it does happen naturally, but the ones that are in the actual medication or the Botox, those are made in a laboratory under sterile conditions. I think they use a bacterial vector or something, a viral vector or something, they produce it. But it is a protein and it's injected directly into the muscle because the way it works is it paralyzes your muscle by cleaving the it gets pretty complicated, but it prevents your nerves from releasing the neurotransmitters. So your brain is trying to move your muscle, but the muscles aren't receiving the signal to get to move. So
Oh, I kind of feel bad.
so the proteins go in there. It's just like any other proteins in your body, and then once it does its thing, your body just, cleans it out, just breaks it down.
And was
Okay.
it originally created to help people that had muscle spasms and other medical conditions?
Yeah, so it's actually yes. So it's because it's a paralytic. It's used for a lot of medical conditions. So Botox cosmetic is for adults who are want to look better. Botox is used as
Migraines.
pediatrics. Like kids who have like tight sphincters.
Oh, wow.
Yes, because it causes relaxation of the muscles. So and then migraines is a really popular one. Another really popular one is for hyperhidrosis or sweating.
Yes,
Oh,
I have a
yeah.
friend that did that
Yes.
in his armpits.
Armpits.
Yeah.
Yes,
Yeah.
yes, takes a lot.
Yeah.
But if you have a decent insurance policy and you have a doctor that's willing to kind of fill out the paperwork, the insurance companies usually do cover these procedures because it's medical.
Do you know if it works on TMJ? Because I've been researching that a lot. And I hear different things.
I think it does work, but I don't think it works for everyone. I've done it on a few patients. I would say it works on half the patients.
Okay.
Usually for the patients that don't have it that bad. I think one of the things for TMJ is that there's about 3 different muscle groups that causes your jaw to kind of go up and down in the socket. And Botox, you can mostly target the 2 stronger ones, like the one in the temple and the one that kind of, when you bite down your masseter muscle, you can feel that big muscle contract. You have one that's kind of like deeper in the skull. You obviously can't inject that one. So you still have muscles that work on that joint. You can't completely paralyze it with Botox.
Okay, and what about?
I'm surprised I still remember so much.
I know.
You got it.
I mean,
You
like-
all coming
you
back
froze
to
all
you.
the memories.
I'm like, thank you, Johns Hopkins. Thank you for the education. I learned a lot.
Straight out of surgery, and you're
I know.
like still on it.
It's like, wow, okay, I remember these things.
Okay, so I have 2 questions. Okay, if I were to get Botox, how long would it take? I heard it has to set in.
Yes. So that one is variable depending on which brand you use. And it's also, it's also just, there's a range. So generally speaking, I feel like Botox doesn't kick in for at least about a week, 7 to 10
Okay.
days, up to 14 days. I find Dysport, which is my personal favorite because I am very impatient. That one kicks in about 3 to 4 days
Oh,
for
okay.
me.
Okay.
Right.
But I heard with that one, you need more of it, right?
So you do because that one, so Botox is usually delivered in units. That's what they call them, units. Some things are grams, some things are milliliters. This one is units. The units of Dysport are a different amount. Like one
So it
unit of
seems like
Dysport
more.
is less than 1 unit of Botox. So it seems like more because you're using more units. So by number, yes, you are using more, but not necessarily by volume.
And financially, because I've had both, and they're sort of around.
Most people price them
double because it's double the amount.
Yeah,
but it's,
most people, because it's such a competitive product, most people, it's like Coke or Pepsi.
Right.
Most
Right.
people just kind of price them around the same. But back to your original issue, I find that Dysport does kick in a little bit faster. So it's like, for me, it's like, I'm the kind of person, like, if I feel like I need it, I need it. Like I'm going.
I need it now.
Like I'm going out this weekend, or I'm going on a trip, or I want to have a wedding I want to go to. Then I will do the Dysport because I don't really have time for Botox. But Botox is way more popular, so people usually just go to Botox first, and then some people kind of swap out or switch.
Because it's a known brand, right?
It's another brand. It's kind of like if you're like if you have your
Starbucks.
Starbucks, you're
versus
not
whatever.
gonna
Yeah.
just go to Dunkin' Donuts one
well,
day.
I've done both.
I love Dunkin' Donuts.
I love them all. So
I've
it's
done them both, and this might be in my head, so tell me if I'm making this up. But I feel like when I've looked in the mirror when I've had Botox, and I used to do a lot. Like in the old days, I would be like, I want to be science fiction. Like,
like Frozen, right?
Frozen,
Yeah.
And now I don't want to do that at all. But when I used to do that, I feel like with Botox, I did feel like I looked a little bit plastic. And then when I changed and started to do Dysport, I felt like I was still paralyzed, but I don't know what it was. Something felt different. I didn't feel as plasticky, and I didn't know whether it was just in my brain. So was that in my brain, or is there a difference between them?
There are little differences, little nuances between them, which, and it all depends on who you ask, because like I said, like the timing thing, some people will swear that Botox kicks in like in 2 days for them. You know, it's like it does for some people, but
Could be a placebo, right?
Yeah, or you know, maybe it's just their body
Everybody's different.
uptakes it faster than
As soon as that needle goes in, I feel like my
You're
face
like-
you feel like everything's frozen already, right?
You're like, yes!
A lot of people feel that. Like they go home, they're like, like it's
look how
working. And I'm
good
like,
I
no,
look.
it's not working. It's just
God.
swollen from all the needles going in the face. Yeah. But so yeah, like in terms of how they feel, I do feel that Dysport stings a little bit more when it goes in than Botox. But a lot of times we do numb the patients for those who are sensitive. So if you're scared, you come to my office. You come to my office, I'll numb you up. It'll be fine.
Like stings because the needle is bigger?
Well, it's
No, the
probably
actual
going
Botox
Oh.
serum, it's a little more acidic, so it does sting. And
Fun
they say that like for every given kind of area that you inject, Dysport has a little bit more spread or area of effect.
Okay.
Very small. So, you know, so maybe that's why you might feel like it's just the feeling is a little different because Botox has a little bit smaller area of
Yeah, maybe
effect
that's it.
per prick. And then the Dysport kind of blends out a little bit more. Yeah.
Okay.
But for me, I use them interchangeably. It's not enough of a difference that it changes the outcomes for my patients when I inject. I don't have to like modify the way I
Do
inject.
you ever do the two products in the one face on people or?
Not on patients, but on myself.
Right.
I get
You
so
do it to yourself?
so I am terrified of sticking myself with a needle. It's just like a self-conscious brain thing. Like I cannot, give myself shots. I'm not afraid of the needle. I just can't visually see it.
Yeah.
So you have to
Like
have
in a
someone
mirror,
else.
I'm just kind of like, I tried it one time and I'm like in a mirror and I'm holding it. And then I took my hand and I went into it because I couldn't bring my hand to put it in. So I actually go to my friend who does it for me.
Oh, okay.
Yeah,
Okay.
so he does it for me.
Did you
but
bring any?
Shoot me up now. I'm ready.
It's actually hard. So I get that question. I actually get that a lot. My friends always want me to bring, why don't you just come to my house and do it after work? As if they're doing me a favor. By me going to their house to do it.
It's so much easier for you.
So much easier. I'm like,
Yeah.
actually, it's way harder because it has to be kept at a cold temperature. So then I have to and the thing is, if I'm transporting, it always has to be on ice. Got to put it in styrofoam. Got to bring sterile gloves, sterile needles, sterile this, everything sterile. And then once I'm done with it, I still got to take it back to the office or put it
Dispose of it.
home.
Exactly,
Put it in, put it in a storage, like a cooling storage unit, and then remember to bring it back to the office. It's
It's a
not,
lot.
No,
So- yeah.
no.
So, I don't know
To
if
all
you
my
have
friends
another
out there,
question.
stop asking me.
Mine's about the alcohol. Because a doctor friend of mine said to me once when I went to get Botox, he's like, "Oh, you're bleeding a lot today. Have you been drinking?"
Oh, I say that all the time. And I say that all the
And
time.
I'm like, no, it's like 10 a.m. No,
It's like getting tattooed, maybe.
Like Botox
Yeah.
parties and stuff with people drinking. Is that?
I've heard that too.
Is that
Yes.
safe? Or?
So there's definitely
Thins your
certain
blood or something.
guidelines that
Yeah.
they tell you to certain things you don't want to do before Botox. So you don't want to have just come out of a steam room or a hot yoga session or something where your blood is really you're very vasodilated, red in the face, sweaty and hot because the blood is pumping through. Because you want the Botox to be able to get into your muscle and absorbed. If it just gets the more blood flow you have, the more the blood is clearing out the area. So you're going to lose some of the potency of the Botox. And that holds true even after you get the injection. So after the injection, for the rest of the day, you're not supposed to go exercise, sweat, anything that makes you red in the face. I break all the rules because I have to go to the gym and all that. But I also have access to all the Botox. So I don't care if I
It's like,
some
I
of it,
just put it back in
but
there.
it is something I do tell my patients. I don't follow my lead. Just take it easy today. Don't go to the gym. Don't sweat. The bleeding part when you get injected, that just has to do with people who drink either chronically, a lot, or drink a lot that's a lie. You drink very close to your time of injection.
Okay.
You do get more vasodilation or blood flow to your skin. So then you may tend to bleed more. Bleeding is always unavoidable. I mean, you are getting a needle on your skin, and you can't expect your doctor to have X-ray vision and to see the blood vessels running on their skin. But when we notice that every single dot that's going in is blood, drops of blood are coming out, then it raises our suspicion. There's no way that every single needle prick is hitting something. It's most likely alcohol. Maybe you were doing something strenuous, your blood pressure's high, or you took a blood thinner, like an aspirin or ibuprofen or fish oil, something that tends to make you bleed more.
So have you ever had to like ask a patient like, hey, have you been drinking a lot?
Oh, I never. No, it's never to the point where it's like you're bleeding out of your face.
You're like, this is a vampire
No,
facial now?
it's just noticeable. You're just like, oh, like, because all you have to do is hold pressure like 15, 30 seconds and just hold pressure over it and it stops. But it's like, it slows you down because then you got to do a shot and you got to sit there. That's when I'm like, okay, like, you know, what did you do earlier? Because I'm spending a lot of time just holding pressure on your face.
And have you heard many horror stories about, you know, like, because I always hear people that don't want, I don't want my face to droop and things like that. For me, I've never experienced anything like that.
Yeah, so Botox is very, very safe. It has a very good safety profile. Most of the time, you know, the biggest issue is going to be bruising or swelling. So if you want to avoid that, you can obviously ice afterwards, take ibuprofen. A lot of patients take arnica and bromelain, which are these herbal supplements. You can just get them over the counter, get them CVS, Walmart, or whatever, and it really helps with the bruising. The drooping, that's kind of like everyone's fear. And it's usually like an eyelid that's like droopy. And I have to admit, when I was a resident training, so when I was a resident training, we used to get Botox for free from the company for educational purposes. And we would have volunteers come in and the residents would be training. And I had like my friend, like an ICU nurse friend come in and she was like one of my first patients and I did it and I dropped her eyelid. So she was like she was like rounding on patients and one of the attendings or one of the doctors, the ICU doctors was like, are you having a stroke? Are you okay? Because one eyelid was coming down.
Does that go away though? Is that because the muscle relaxes,
it does
right?
Go away.
So it would
so
just
like,
went down. Okay.
So like I haven't had one of those in like 5 or 6 because now now I'm more experienced. I know exactly what I'm doing. But
that's why you have to be careful who you go to though.
I know, but it is temporary. It is temporary. But the thing is, it's as temporary as the Botox is. So it can take a good 2 months.
You can dissolve it. There's something to dissolve.
There's nothing to dissolve Botox. Filler, there is.
I thought there was.
So filler, there's a reversing enzyme that immediately dissolves it.
Okay.
Botox, there isn't. Botox, you just wait it out.
Okay.
But it's kind of like one of these. That's kind of like why you can't even, you know, like if you were trying to even sue your doctor because you're like, oh, you messed up my Botox.
By the time you
even like the paperwork gets even filled out, it's already over.
It's over.
Right,
It's like you can't really complain. It's like having a bad haircut. Just wait it out. What are you going to do about it? But there is, specifically for the eyelid, there is a special drop that you can prescribe that temporarily lifts it back up a couple of millimeters. So like if you have an important meeting or a photo shoot,
like
you can
Igor.
just put little drops in and you're good for like a couple hours for the day.
Cool.
Yeah.
It's like,
It just lifts it
And then later it goes.
not for everyday use because it has side effects, but it's good for like, you know, if you have like really important meeting or something.
To do. Okay. And my last question. How much does something like this cost? That's another thing. Like, I know it ranges, right? Depending on how much you want, but like, I don't want to get into something that I can't maintain.
And you do want to know that before you
want
walk in.
and then I get
because
confused.
I've been
I get
charged
confused
like
looking
a
at the
lot.
prices.
So this is very variable for multiple reasons. Number one, depends on obviously the location. So if you're in LA or Beverly Hills, you know, it's going to be a little bit more expensive.
Yeah.
You can definitely find your cheap places.
Groupons.
That's
going to have your eyelid drooping
but I've actually seen a lot of those. And no offense to them, you know, I think, you know, like a lot of them are reputable. But I have definitely seen the ones where I calculate how many units it's supposed to take to treat an area and how much they're charging you. And I know it's impossible because I know how much Botox costs.
Yeah.
So I'm like, unless they're literally paying you to get Botox, there's no way you're actually getting the amount that you're getting. Because there's no way you're going to know if you're getting 100 units or 10 units.
No
you don't
way.
know.
Yeah.
I know.
It's just a syringe of liquid.
And that's
that they
where I get confused.
So
I'm like,
you don't
I don't
know.
even know
Yeah.
how
You
to
know.
even, in my brain, I'm like, I don't know
But
how to even calculate this.
Yeah, but generally speaking, there are 2 ways that they charge you for Botox. One is per unit and one is per area. So
I like the per area better, I think.
yeah, I usually just go per unit because I like to save people money. So like if you have a smaller forehead or your muscles are more weak, you don't need as much Botox. So I mean, why am I going to charge you
Okay,
as
that
much?
makes sense.
Because if you do by area, the price is going to be the max price because they want to cover everybody, right?
And my muscles are way stronger than yours, for example.
Yeah, so men in generally,
Yeah.
men generally do need a good percentage more of Botox than women do.
Oh, okay.
That
Good
is
to know.
interesting.
Well, I went. This is not a horror story, but a financial horror story. There was this new doctor in Beverly Hills on Instagram, and he had like $9 a unit or something like that. I don't remember. Anyway, I was like, and I never buy things like that.
Yeah.
But I was just like, I must have been lying in bed or something. I'm like scrolling through, and I'm like, oh, he looks cute. Yeah, I'll go to him. Like I'm single, and maybe I'll get a date out of it.
Yeah.
So then when he did it, and because I've been doing it for so long, I know how many units I should be getting. And when he said the units, I was just like, no. But I was like, whatever. It was
a lot more units, right?
It was more.
To compensate for the lower price.
Yeah. But then when the actual figure, the numeric figure came out, I'm like, okay, so in money terms, that was more
exactly
than I pay at my other Beverly Hills doctor at full price.
Yeah.
I was like, and then he said to me, oh, can you leave me a review? And I said, I would love to, but in my review, I'm going to say that you charged me a hell of a lot more than anybody else, but you did a great job.
Yeah.
But don't say you're on special, because it's not a special. Just be real.
Yeah, the other ones I see are people who go to parties.
Oh, yeah.
They're like, oh, my nursing friends just gonna come over and like we're gonna have drinks and there's like gonna be 20 of us and we're just gonna get our Botox done. And like a lot of times I sit there and I calculate the price. I'm like, that doesn't make any sense. Because again, like I said, like even if it's exactly how much the Botox costs and they added like $1, that still doesn't cover the needle, the alcohol pads, like it's still there's other costs than just the actual Botox, right? Yeah. So I'm like, unless they're spending like 3 hours out of their day to make $5, like I don't see it happening. I mean, some of them are good, but like just like I said, I'm not trying to poo-poo anybody or that. I'm like, I've done those parties before, you know, but if the pricing is like too good to be true, it probably is.
Yes.
Well, so then does it expire? Like, do you have sales where it's like it's about to expire?
So Botox, every medication, anything in medicine has an expiration date. So every box will have a expiration date. But on top of that, Botox comes, or any of the brands of botulinum toxin comes in almost like a powder form in a bottle. And you have to mix it right before you use it. And after you mix it, you have like a certain couple of days that you could probably still use it and it'd be still very effective. But obviously the longer you wait and use it, like if you use it 1 week from now, 2 weeks from now, 3 weeks from now, it's getting weaker and weaker because it's already been mixed, you know? So I mean, I obviously like to try to just finish the bottle in a day. That's why they have different size bottles. You can open a smaller one or a bigger one, depending how many patients you have for the day.
Probably why clinics or doctors might say, you know, Thursday's my Botox day or something.
Exactly. Yeah.
Oh,
like it's, you know, especially if you're a surgeon or someone who doesn't do Botox all day long, it would be very hard to do like one patient on Monday and then one patient on Friday and then just 4 days of that bottle sitting there doing nothing.
Gotcha. Okay.
Well, that's interesting too. So, but wait, as far as like the parties go, where they're like on sale, would a doctor do that because it's about to expire?
I've done these parties before. Usually but it's usually like in my office after hours. I usually have like the company rep come in, talk about other products. You know, we'll serve like snacks or things. I did this way in the beginning when I was kind of like, you know, trying to get myself out there and meeting the people. But you do have to be careful with these because especially the ones that you're not supposed to serve alcohol at these things because you should not be doing any medical treatments with alcohol. Yeah. Like under the influence, you can't even technically give consent because you're under the influence, you know? So you're like, oh, I'm drunk. You know, I'm drunk as hell. I'll stick the needles in my face.
I didn't know what he was doing.
The doctor didn't tell me I was drunk. How did I know? You know? Yeah, exactly. So, I mean, you are still getting a medical treatment. So it still needs to be done in a sterile environment, clean, proper procedures, you know, consent and all that. So if that's all kosher, you know, and the price is good, then yeah. And I've done it before. Yeah. For me, it's not to build my business or to generate revenue or,
not
you know,
anymore,
to make a living.
Yeah.
For me, it's either it's like a gift back to my patients, like to my like returning patients, like, oh, you know, we're going to have a Botox day or something like that. Or it's to promote my practice or maybe a new product. We use Botox a lot of times as a gateway drug.
Right.
Because it's affordable, everybody knows it, and it's a great way to bring people in. And then you can talk about
upsell it.
well, I mean, not necessarily upsell, but you can talk
joking,
about
yeah.
like the newest filler that just came,
Yeah.
you know, that was just approved in the US. You know?
And I feel like a lot of people too, if you do go and get Botox, it may be the first and only thing you might ever do because it's not so scary, or it's like it's exciting, like, oh, I just got Botox, you know, I feel great.
Yeah.
So it's not like you're getting a tummy tuck.
No, it's kind of like when you do your first facial or you get your first massage. You just start taking care of yourself.
Yeah.
It's just maintenance. You're literally not changing your face or your body or how you look. This one is literally just maintaining how you actually look. You know.
Well, one of the things I love about Botox, and I don't know if we're going to talk about any benefits, but one of the things that a benefit to me mentally is that because I work a lot, so there's days where I wake up and I'm tired, or most days I'm tired, especially if I work and I work out.
Yeah.
And, you know, and so I love when I have Botox again this week, or had it now a couple of weeks ago, because there's a period where I didn't have it, and I woke up and I look in the mirror and I look tired. But then when I get it, I just know that I have a confidence that when I get up in the morning,
It's like a mental
I
thing.
know,
It's like a haircut, fresh haircut.
it really
Yeah.
is. And it's
Yeah.
like, I look in the mirror and I'm like, bitch, you don't look that bad. Like, you're good. Like, you can
You're
get on
doing
with your
good
day.
today.
Yeah.
And it does give me a confidence. And
Yeah.
I know it looks better, but it makes me feel better.
Well, and now it's in movies too, where people are like looking down on you if you don't get it. It was in Crazy Rich Asians. Do you remember that?
Oh yeah, but
She's
those
like-
are crazy rich
she's
Asians.
like- she goes, she probably doesn't even get Botox.
Yeah.
And I was like, oh my God, everybody needs to get Botox.
I mean, yeah,
It's like trendy.
I think it depending on where you are, it's like cool to be able to get Botox. You know, I mean, obviously not in all parts of America, but you know, there are definitely a lot of people who, you know, it's to have the privilege of being able to afford Botox when you're younger to, you know, maintain yourself and look good. It's like buying really nice, expensive clothes for yourself. You know, it's kind of that level. So it is good, and it's also a great gift for people.
Oh, yeah.
You know, like, you know, people give spa packages, people give all of these things.
Nice insert there.
Yeah. And, well,
Where can we get your vouchers from?
my gift cards are on sale. No, so it actually is a really good. I've had like sons and daughters like say, "Oh, I want my mom to get some," and even if it's really, you know, like they can't afford all whatever 50 units, they just, you know, pay for 10 units or
Yeah.
15. It's like very
And
flexible.
if you do like Botox, that's a really
My
good
mom
gift.
loves
You
Botox.
know,
Oh yeah.
She's like,
I mean, I literally-
just got some. She's got the phone.
I literally have people just come in and just get their crow's feet, and
yeah.
that is like. That's literally like the smallest
That might
amount
be where
I
I
can
would
put in.
start.
It's like nothing, just to get these lines in there. Yeah.
I think if you're going to do it, you just got to do it.
The whole face.
No, you don't have to.
I need to
Just
dip
do
my
it.
toe in the pond first.
I would say like, because I was like, some people say I want to be frozen, and then some
yeah.
people obviously like, especially like, you know, people like you who are on camera or entertainment or, you know, like public figures, they don't want to look frozen.
Like actors and
Yeah, so that one's definitely like a really fine balancing act
Yeah.
because I kind of have to like titrate, gives like a couple sessions where I like eventually I know exactly how much they need so that they can still move and make expressions,
Exactly.
but
And
without
I need to be able
paralyzing.
to, if you have too much here too, I noticed, I try to smile or talk and it's like my cheeks don't go up. Or
Yeah,
they
because you
don't move.
can't, you're not
can't go
moving
up.
as much tissue up. Yeah.
Yeah, there are some celebrities where they're like on camera and you can't
Yeah.
even see like their expressions.
Yeah, a lot of
You know?
times that's also because
no.
they also have
Something else.
probably like filler or facelift because now you're adding something that doesn't really move into that area. So then they look really stiff, you know? Yeah.
But I mean, I don't know if we have any more questions about Botox.
No,
but
yeah.
you do a lot
Oh my God, I could
more than
talk
Botox.
about-
yeah. I know you do a lot more
Yeah.
than Botox. You are, I said it in my head the other day, like a beginning to some people's ends, right? Where it's like a brand new, you know, you do all kinds of other stuff.
Yeah.
Like what?
Makeovers.
Yeah. Like
Yeah.
what is, I guess, maybe your number one thing that people get from you, like your expertise? We can talk about that.
So that's a good question. So if you were to ask me what my expertise is, I did do extra specialty training on my own after I completed all my plastic surgery training. I went to Atlanta. I worked with the late Dr. Mark Conner, who was like one of the world's leading experts on eyelids and facial surgery. So I kind of did an apprenticeship, or we call it a fellowship, with him before moving here to LA. So that is kind of like what I do specialize in. But I do, if you want to say like what is my number one procedure right now would be liposuction, just because it is the #1 procedure in the world. Like everybody,
For men and women?
Like I will do an eyelid, and at the same time they're like, "Well, I'm already asleep. Can you just lipo my area right here?" And it's just they just get it included.
And it's a vacuum, right?
Yeah.
It's like
So liposuction is the most popular procedure, hands down, across the board for everybody. And that's literally just a metal tube with negative pressure or suction, and it sucks out the fat.
I'm so curious because I watch those videos and I'm horrified. I can't, like, I try to watch them.
Well, then just go to the gym.
Yeah. But I want to know, you know, when the thing goes in,
yeah.
Is that which
So those
part
are
is sucking
cannula.
it?
So at the very tip of that metal rod, there's little holes cut out, and there's different designs, and different styles, different brands that make them, and they're all designed to literally just gently kind of break the fat apart into little pieces, and then you just suck it out. So
On that same machine?
it's kind of like if you ever had a steak or chicken and you can see that like vein of fat. It's, just imagine that like as a layer underneath your skin. And that's what the machine goes in and sucks it out. Now, a lot of people do extra. There's like nowadays, like technology is so great. We have extra things that are added on to that. So some of them add laser to help melt the fat to make it smoother. Some machines add ultrasound to break the fat up faster and break up scar tissue. So if you've already had lipo, you have more scar tissue. It's great for those patients. So there's extra things that people have been doing with liposuction. And liposuction is rarely done. Well, I don't want to say rarely. In my practice, I rarely do liposuction alone. It's usually like an add-on procedure.
Oh, I see.
Right. Like, I'm going to get a tummy tuck. I'm going to get my mommy makeover. My breasts are going to get lifted, maybe put some implants in for some cleavage. And I want to have that snatched waist that I had when I was a teenager before I had all my kids. So I'll do the tummy tuck, but I still got to do something about the fat because the tummy tuck gets rid of skin. So then I add liposuction to it. Or I do the breasts and they've got that, that little.
I hate that.
Yeah, I just did once. that was the one I did today. So then they'll have that extra right there. And so I just, go through the armpits so you don't see anything and just knock that out. I wanted to get the.
Do you do the abs and do you suck it out?
So I used to do the
want.
etching, the abdominal etching. I used to do it. I don't do it anymore because it's. I think the people who know how to do it well do it great. I think it's good. But for me, it's the long term. I find it's like it puts a lot of. I get nervous. I get nervous that I'm going to see the patients in 10, 15, 20 years, and I've already etched the lines in them, and the lines are permanent because you essentially, because you've already thinned that whole area down of the skin. That's not naturally.
So that's how they really get
Yes,
that.
you're not natural. Those aren't your natural abs. And then they leave kind of some of the fat in between. So then, but I mean, like, honestly, to me, I find it very difficult, especially since I'm in my 40s now. I find it very difficult as I get older and older to keep the fat out. To keep the fat off, right? So I can only imagine if I had that procedure done, I would be getting more and more stressed as I get older of like keeping it looking natural. I've actually had to do a couple patients that gained a little bit of extra weight, and then they look. Well, it's the existing fat that you still have grows.
Okay.
So then they look a little puffy, like a little bit like English muffin.
I see what you're
abs.
saying.
Yeah, you know what I mean. So then I have to go back in there on those patients and suck out that extra fat that they've gained.
I did think about that because I do look at those videos and go, oh my God, I want that.
So I'm kind of like, and I've gone to parties where I've seen older gentlemen who obviously had it done before, and I'm like, so that's what it looks like when you're older. So it's because
like I don't want to be a part of that.
Yeah, because personally, I haven't seen. Obviously the photos that you see look amazing, but it's usually like 6 months right after the procedure, and they're still young and hot. I'm like, how about people got it like 5, 10 years ago?
Years
I haven't seen any of those. How do they look? Yeah. But I'm not saying that I'm not against it. I just don't do it myself.
Gotcha.
I leave it to the experts. There's a couple people that I know that do it a phenomenal job. So I'll just, I let them do it because they're really good at it.
Do you do that on women where you suck the fat out and put it somewhere else?
Yeah, and I do it on men too. I do it equally on men and women. Women clearly want more on the hips and the butt. Yeah. The hip dips. They want kind of like a Sofia Vergara body, snatched waist.
I love her.
Yeah.
Love her.
She's amazing. Snatched waist, but obviously full hips, full butt. Men too, especially here in LA, WeHo, Beverly Hills, I get a lot of the guys who they don't necessarily want like Kim Kardashian booty. I mean, occasionally they do, you know, but I usually get the guys who want a
Calves.
more, well, they want more of like like athletic butt.
Oh.
They want to be able to wear jeans and kind of have that shelf.
Yeah.
Yeah, they don't necessarily want the hips, but they want
You
to.
put it in the chest.
I have. I
Put it
do.
everywhere.
I do.
want that.
I
I've
usually,
never
Suck it
had
out and
that.
put it
because I
wherever you
think, you know,
want.
a lot of guys have that opposite problem where they get the fat at the bottom half around the nipples and they start looking like they have man boobs, right?
Yeah.
And then they're really flat up top. And every guy wants to wear a shirt and just have a really nice drape.
Yeah.
I mean, every
Yeah.
girl wants their guy to have that, like
Oh,
they
the
wear a
back.
flowy t-shirt and they have that nice,
Yeah.
like
Always wanted
chest
that.
up there, right? So then I can do that with taking a little fat from your waist. You might as well get you a nice V going. And then put the fat up in there.
I was just
Yeah.
thinking, I saw this one girl. She was like, "I don't want to date you. You have bigger boobs than me."
Oh
I
my
was like,
God.
"That is so
I can fix
mean."
that.
He's like, "I
Yeah.
can fix that."
I can fix that.
Yeah, people are cool, but okay. So yeah, that's very informative.
Well, ladies, I mean, since he's here, since we have the doctor, does anyone need a consultation?
Could you imagine?
Oh no!
Could you like blur?
I won't be able.
Could you blur?
I'll
It's like,
crying on
they
camera.
totally like flash. It's like blur.
I need you to bust out your marker and everything. Tell me where I need to get Botox or filler or whatever.
Well, and then because this is for the Skin Research Institute, that's our company. We do need to, I guess, address the whole part where like people who are afraid of the needle and the knife creams. Do you have any creams that you suggest?
Yeah. So I mean, you know, beauty's been around forever, right? So we have the full gamut of things you can do. Just remember, the less invasive something is, for the most part, or pretty much every time, it's not going to be as effective.
Sure.
So you're going to have to either start it earlier or use it more frequently. So the stuff that you don't have to necessarily go to a doctor's office for would be like just the general skincare. Like the most important thing is obviously sunblock. Like the sun is your worst enemy. Then it's your lifestyle, right? You got smoking, alcohol, those things. I know, right? That's why I don't go in the sun or drink or smoke. But so like it's any of those things. So those are lifestyle changes. Then you can start doing things. So you can do the non-medical things, facials, creams. You know, a lot of the things that I like that are non-pharmaceutical grade or non-prescription would be like vitamin C serums. That's really good for
broke my name
anti-aging.
today.
The hyaluronic acid.
Hyaluronic acid serums are really good. And
They
then
sell those. It's like $90 for like this
Yeah.
much.
I
What
know.
about stem
I know.
cells?
Stem cells are still
Like, do people get
pretty
stem cells
new.
injected?
They do, not necessarily for skin. They do more PRP
Oh,
for that.
PRP.
That's the Kim
PRP.
Kardashian
That's-
one, right?
But that one you do have to get blood drawn, so it's a little bit more invasive. They take your
Okay.
blood, they spin it down, and take.
I would do
like
that.
same day.
Oh yeah,
Yeah, they
same
spin it.
same hour. Yeah.
Then
yeah.
they put it on your face, and I think they.
That's the Kim
microneedle it
Kardashian
in.
one, right?
Yeah.
Yeah.
The so it's like there's a company that trademarked it originally. It's called the vampire facial, but it's the generic term for it is just PRP. Yeah.
Okay. See, it's all the same.
See, it's all coming together.
All coming-
Yeah,
we were
and then
very
you can
confused.
move your way up to like also retinol. Retinol's it's a
Retinol.
vitamin A derivative.
Yes.
Then you can kind of move your way up to the prescription stuff like Retin A cream or tretinoin. That's the prescription strength of retinol.
I have a Curology thing.
Yeah, so those are
It
good
has like
too.
some of those ingredients.
Yeah.
in it.
So then it's like creams, then the minimally
Then the
invasive,
pills.
then like go into Botox,
Then-
and then like when do people? It's like the end all. Like you need to go see Dr. Lee right
So
now.
usually the thing the thing that pushes most people into surgery is just too much skin.
Okay.
Because the creams don't make skin disappear. You can lose weight on your own. Nothing really makes skin disappear.
Like,
Okay.
Like sagging
Like-
skin.
Yeah, so let this be let this be a lesson to the children and to the future parents. Not that I'm promoting like unhealthy lifestyles. I'm promoting super healthy lifestyle. But just keep in mind that once you stretch out your skin, it doesn't really tighten back up. It does if it's a little bit. You can gain a little bit weight here and there throughout your life and lose it. Your skin will always be very elastic. You gain massive amounts of weight, start getting stretch marks, your skin has lost its elasticity. It's lost. So it's like, think of yourself as a leather couch, right? Once it gets worn out and the leather gets stretched, it's just always loose. To really look tight and shiny again, you got to reupholster it. You gotta pull all that leather, stretch it out, and cut it, and staple it back together, right? So we're just walking.
visual.
Yeah, we're all just
Do
walking
you want to
couches.
be a leather couch?
Yeah.
I want to be shiny.
Your face is a leather couch. You just gotta like pull it back, cut off the skin, and reupholster it. you know?
Okay.
Yeah.
So even that you can't prevent. Like
Skin now. That's why you'll never see, 70, 80-year-old, 90-year-old person that has tight, naturally tight skin.
Joe, the one, she's beautiful.
Cher.
Jane Fonda.
Oh, yeah. Well, obviously.
but she's had a lot of work.
Yeah.
But and amazing. I mean, she looks
good.
She looks amazing.
Yeah,
she looks really good.
Oh, can I tell you? I worked with Joan Collins recently, and she's 88 years old. And she swears that she's never had anything done.
No,
she
doesn't.
don't know. I actually don't know, but she swears she hasn't. And I've seen her at home without any makeup, and she is incredible. The woman's skin
Like
really,
flawless.
She looks like a woman.
Like, I don't know if
and-
she's never had, I don't know if she's never had anything done, but it is possible to still look fantastic because she's never she's always kind of stayed the same weight her whole life.
She looks the same. Yeah.
And she's probably always protected her skin.
Yeah.
They've done these photos of like the monks who live in the monasteries in like Tibet, and they literally like live in their whatever their monastery is for their entire lives, and they literally look so young, and they're like 70 or 80 years old.
You
You should
haven't
Google it.
been, but this goes
And then
back
they
to
compare
lifestyle.
it.
Like
They
you're
compare it
saying.
to a guy who lives in Australia and is out on the beach all day, and then you see like how different.
oh,
I
yeah.
wish I
can
would have
look.
used sunscreen early. I just started
know.
using sunscreen
I know.
at 30.
I
always
only,
really-
Yeah, I know.
only started using it after I did my dermatology rotation in med school, and I saw
You were like,
every single day. I just saw the patients that came in and what happened to them there, and all of their stories were the same. They're like, "Oh, when I was young, we used to put baby oil and iodine, and we would put that all over skin, and we all sit there in the rooftops with the
Yep.
and
guilty.
they would all have the
Too,
same
yeah.
story, and they would all just be covered in like spots and like scaly things and wrinkles.
I don't have that, thankfully.
That's
Yeah.
what life was like. I don't know. I grew up in the 80s. I'm assuming most of us at the table did.
Yeah.
But especially in the 80s in Australia, that's what we did. We went to the beach and we sunbathed.
Yeah.
And it wasn't until maybe mid 80s that we were not even allowed to go outside the schoolroom without sunscreen. So it's been drilled into us because the ozone was so bad down
Right, and Australia has the highest rate of melanomas.
there. Uh-huh.
Yeah. And they're so fair skinned. On top of that, they have so much
Closer
sun.
to the equator, right? I could be wrong. Geography is
We're
not
around
my
there.
thing.
We're around there somewhere.
They kind of take the whole hemisphere,
I
actually.
like how you doubted yourself
Yeah.
right after.
No, because I was like, that is not true.
It sounded smart.
It did. I should just roll with it. Okay.
I
Anyway.
believe
like-
too. And I'm from there.
Okay.
Well, do you guys want to get into the champagne hour?
Yes, I think it's time for us to,
Do some roasting?
and figure out who has went under the needle and who has not.
Oh God, I'm not okay.
Are we gonna drink?
Disclaimer:
during this?
I,
we're gonna pop it out.
disclaimer,
Because
I don't know any of these people personally. I don't mean to offend.
Look,
I love all these celebrities.
I'm nice to everybody
I
until I
am.
start drinking. No, I'm kidding.
Oh my
I'm
God,
kidding.
you're angry.
Like you.
It's funny though. There are like angry drunks and they're really happy drunks because sometimes you can like maybe you know
Depends on the alcohol.
definitely.
I'm a
but
sleepy drunk.
You're sleep. I am too.
Yeah, that's why I don't drink.
Well, brown.
Also,
if you
skin.
drink the brown liquor, that's when you get the angry drunks. Or let's just say a little more excited. Yeah,
What? Oh, okay.
like Hennessy's and.
I also don't drink champagne because it gives me a headache.
Yeah, it does.
I used to do that.
And it doesn't matter like what kind. It could be like,
Me, it doesn't matter. I feel like
J. Roger.
it doesn't matter what
Yeah.
it is. I just go puffy in my eyes and I hate
yeah.
it.
And then
Especially
we're
at an
like-
It could be
event.
We need to go
dumb.
get
It
some
could be
filler.
it could be like Trader Joe's. It's just gives me a headache. Too dry.
I'm so specific. If I go to an event and I know I'm going to be photographed, I will not drink champagne.
Oh yeah.
Really? Do you
also-
feel like it
Or
makes
if
you
I'm
photograph
drunk, I
different?
won't be. I don't want to be photographed after.
Every time somebody pops a champagne cork, I always think someone's gonna get.
Protect my eyes.
I was on a boat in Sweden when I was living there, and we had like rosé out in the ocean, and it was hot, so I started to.
Do it.
And
Yeah.
it just went.
And it was like 3 stories in the air.
Oh my
Oh,
god.
thank God you pointed away from you. Cindy Gardner. Now that's not a recent photo of her though.
This is 2022.
Well, I mean,
Is
it's also,
it?
Yeah.
it's also not fair because
She
it's
looks
Photoshop.
It looks photoshopped.
It's Photoshopped. It's hard for me to.
Do you want one in front of you, or do you want?
I'll just have one so I look cool,
Okay.
so I can be one of the cool kids, but I won't actually drink it.
And do you? We're just gonna.
Because you got to go
sip
back to
on
work,
this.
right?
I'm gonna chug.
No, I'm actually done.
I'm joking. I'm not gonna chug it.
Once I'm done, once I finish my last surgery, that's it. Yeah,
Oh, that's nice.
Are you done for the day with your surgery?
with surgical stuff. Yeah.
Thank you, sir.
This is nice.
welcome.
It actually looks really nice too.
Well, supposedly this is a really nice bottle.
Yeah. So this
This isn't a plug either.
no, it came from this winery in Napa Valley. It's this guy
a castle.
he renovated. That's the word. He renovated a castle. Oh no. He built this castle.
Yeah.
and it's
on the
really
winery.
beautiful.
Yeah.
Yeah.
Pete's gonna like that part.
Yeah.
This segment brought to you by Spumante. Costello.
Exactly.
Please send us a case. Thank you.
We will require more of these for our next show. Yeah. And we're gonna come visit.
Yeah.
So you want to maybe?
All right. So what are we doing here? Are we saying what we?
I think this is
these people have done.
First
or?
of all, I need to actually see like a candid like paparazzi photo because it's
Okay.
so Photoshop. I don't even see her mole. Like her mole's barely existing there, you know. And she has a mole right there supposedly.
Yeah. Okay.
It's so
that's true.
Photoshop.
Well, I would say I was at a party with her a couple of years back, and
She looks amazing though.
I was shocked. She looked stunning,
Yeah.
and I'm
She's
sure
got
she
that
may have.
melon
I'm assuming
extract.
she's had something done, but I looked at her and I'm like, you are one of the most stunning, natural-looking women of your age, but just in general.
Well, I
So
do
do you want me to
remember.
Google?
No, it's okay. I do
okay.
remember seeing photos from her over the last decade, like just casual photos on magazines and stuff. She's always looked good.
Yeah, she always.
Like
does.
I don't think she's ever looked done or anything crazy. Whatever she's doing is probably minimal. She used to have those infomercials on TV.
The melon plant. The melon
but
extract.
also with her, like, isn't it? She was like with her dermatologist from France or
She
something.
has a
like
beauty
that.
line, actually.
Yeah, and she probably now has a beauty
She
line.
has a
So,
beauty line.
I mean, I know her skincare is on point.
Yeah.
So that's.
Is this where you're going to tell us you're her doctor?
Oh my god, I wish.
Hands by the way.
310-556.
Call me
I wish she was my patient, but she looks amazing. I mean, if anything, maybe she's had Botox,
Okay.
you know, but I don't see anything like glaring on her.
Well, yeah, if this picture is photoshopped, then that would make it looks like her skin is really smooth. But I did see another picture though. I mean, she is aging gracefully, I think, but I would say like I don't know. It's kind of a throw off because she has all the skincare stuff and those infomercials with the melon extract. So
And she had a workout routine too.
yeah, you might think that
And I
like
can't-
she doesn't do it, but
and-
I assume maybe she does.
By photos, you can't really tell if they've got stuff like lasers or radio frequency, like the
Yeah.
skin tightening procedures.
Yeah.
Those are hard. You can't really tell much from photos. I mean, her jawline is so sharp in this photo.
Well,
And just like, I mean, you could get that jawline with Botox, but
So let's see.
you know,
let's see what she says.
In 2015,
she's like, it's genetics.
she told InStyle magazine, "I'm not going to lie to myself. Past a certain age, creams work on the texture of your skin, but in order to restore elasticity, all I can really count on is vitamin injections, Botox, and collagen."
See, I got the Botox right.
Yeah.
What's vitamin injections?
What are vitamin injections?
I mean, a lot. There's like a lot of different things you can
About to be
do.
really, really rude.
There's like vitamin B, glutathione.
I got it. I got it.
But there's definitely a lot of there's a lot of injections that you can do, mesotherapy. So it's like certain vitamins, like there's
you
vitamin
mean
C,
into the
there's
face?
or IV.
Or
There's
IV.
two, like
Oh,
glutathione,
yeah. I've seen
vitamin
that.
B. Yeah.
But collagen
there's
you
little
can
cocktails
just drink,
that you can
right?
do.
That's it.
But
Collagen doesn't really, you know,
You have to drink it, no?
well, it doesn't really make sense, right? Because you eat collagen, it has to break down into little pieces before it goes into your body, and then your body doesn't magically remake into collagen. But
What about collagen pills?
that's what, yeah,
Same
that's the
thing.
same thing. I'm
Ah.
like, just eat steak, but I don't,
She said
I don't,
just eat
I don't
steak.
necessarily think. I personally don't think collagen pills work.
Oh,
Yeah.
well, that's good to know because I was going to buy some.
I would rather do like PRP. I'd rather do
Sorry.
PRP.
Oh,
or
No, I was just
God.
gonna say. She said she owes the quality of her skin to her cosmetic surgeon. So, ding ding ding.
Who is it?
We don't know.
See, I love her. She's so honest and beautiful.
Yeah.
Like, yeah.
Okay.
Okay, we're going to Nicole Kidman.
Now she looks really great in all of her shows that I see.
I mean,
Well-
I literally go to AMC theaters just to watch her.
Just to watch
Just
the
to watch
commercial.
her.
Yeah. And she's Australian.
She's Australian. I've met her
Yeah.
quite a few times. And as a woman, I love her.
She's tall.
She's tall. She's very thin. And I've never seen skin in real life. I've never seen skin on a woman or a human being like Nicole Kidman. And I'm talking without makeup. This woman is incredibly flawless.
Yeah, it looks always very moisturized.
Yeah.
I do think she's had a little bit too much of something done. I don't know whether it's a filler here.
I definitely think she for sure has had Botox because there's been certain times where I just like her forehead does not move at all. And she has a taller forehead, so it's a little bit more noticeable. I definitely do think she's got a fair amount of well-placed filler in her cheeks, her jawline, her chin to keep her jowls blended into this area.
When people look like that, which is
like a duck lip or like a frog,
or, like a frog. Is that a lot of filler here that it's like pushing the lip?
No, it's a lot of times it's filler directly in the lip, but it kind of travels up under the skin, and your whole upper lip area here gets like thick and rubbery.
Like Kylie Jenner?
Kylie Jenner.
Kylie Jenner?
You want something more to drink?
I love Kylie Jenner.
I'm not even...
Oh my God.
See, I told y'all I was going to sip, and I'm already almost done.
I was like,
no more for me. Just
love
kidding.
Kylie
Bring it on. Kylie Jenner.
Amazing.
Kylie Jenner. So like something like that, like, I mean, we all know she's probably had her lips done because she had zero.
Oh, 100%.
She had lines,
Oh my
right?
God, yeah.
So will something like that travel up, like he's saying? If you had Kylie
If you
Jenner.
do too much of any filler in the lip, it will just push up. So this whole area will just get thicker and thicker.
I mean,
Yeah.
I hope she's not going to watch this, but Lindsay Lohan is
She
like
might.
so awful.
You know, I haven't seen a recent one. I haven't seen
Lindsay
her
Lohan?
recently. No.
I just watched a really awful movie with her.
Netflix?
No.
Oh,
saw
I
it.
loved it.
I
It was
liked
so
it.
cute.
It was cute.
It was so awful.
I love those horrible movies.
Oh,
I liked it. It was really cute.
sorry.
Anyway,
I'm gonna get banned from
I'm
the show.
Yeah,
curious.
because-
I wanna
okay,
know-
so
I want to know
here's-
if she's admitted to
But here's
anything.
like a thing.
gonna say yeah.
Here's the thing that when I look at like especially her in this photo, so a couple of things that stand out to me, right? She's definitely has naturally aged beautifully, but you can see in her hands
And
that she's a
here-
little bit, and around her elbows, there's like
Yeah.
the little fine wrinkling
yeah,
of the skin just being thinning, more crepey in that area. God, she's gonna hate me. I don't mean it in a bad way, Nicole. I think you're amazing, and you're gorgeous. But even in kind of like the armpit area, all that, you can see that that's just completely natural. Everybody's gonna get that.
Right.
Actually, a lot of people aren't gonna get that because a lot of people never get as lean and toned as she is. That like if you don't have that, maybe you might think you look hot, but maybe
likes
you
you
have more
again. She
fat.
likes you.
Yeah. So she's very natural. And you see that even in the neck, right? Kind of like you see every muscle, the skin
All I
gets
see
a
is
little
that
bit.
bling.
But then once you get up into her face, it is smooth. It is
Yeah.
smooth.
Smooth.
And she's not
plump.
smiling really hard. I always got to remember that in
Yeah.
pictures just to be like,
Yeah. So I think
Not
she's
like me.
definitely done a lot of maintenance, probably
Yeah.
fillers, skincare, and obviously Botox. Those would be my top 3 for her. Yeah.
ready?
Let's see.
Yes,
And maybe even a rhino like decades ago, but yeah.
Oh, really? To nose?
I think she might have had one, yeah.
Okay, in 2013, the forever youthful Nicole Kidman rejoiced. What?
I can finally move my foot. She dissolved it. It's
See,
not
that
me.
doesn't
that's a
even
lie.
that
It's a
doesn't
lie.
even make sense because you don't dissolve.
Right,
So most likely she probably dissolved a little bit of the filler to
After
make it less
dissolving-
stiff looking.
Oh.
Yeah.
She's lying.
But it's easy just to say Botox to cover it all up.
Sure.
You know, it's like
please.
it's like visiting the dentist.
I mean,
know?
I love her. I never want to say a bad thing about her. I love her, but bitch, please. Are you kidding me?
Because
Like,
Botox you don't have to dissolve; you just let it wear off, and it only takes you 4 months. It doesn't take years, right?
and
Lies.
I mean,
So-
the shape of her mouth is completely different now.
But she looks incredible.
she looks incredible.
If you're gonna do,
But own
if you're
it,
gonna,
just own it.
if you're gonna do it, you
Maybe
should.
she's owned it.
If you're gonna do it, she did it the right way. You know what I mean?
Yeah, because that was
I
like
love
what?
it.
Yeah.
So
2009
years ago?
I will say though, in real life, she looks like she hasn't had anything done.
Well, that's
That's
good.
even
Which I
better.
love that.
That's even better.
Yeah.
In a
that's
good
even
way.
better.
In a great way.
Not
yeah.
you need to go somewhere.
Yeah, no, like I mean, she just looks like she's naturally.
I mean,
flawless.
when I see her on, the AMC previews and she does it and she's talking, that's like the best way to measure someone's work, right? Because when she's talking, she looks completely natural when she's talking. Her face looks natural and soft and moving. So I'm like, I don't care if she's gotten work done, but I want to know who it is and what they did because she looks amazing.
Yeah. All right. Next step.
I didn't even recognize her. I had to read the name.
She's always changing. I think she looks so good right now, though.
She does.
Is this what she looks like right now?
This is 2022.
Yeah, I think now that she's broken up with Kanye and she's like working on herself, she looks so good right now.
Imagine how stressful.
I just love everything about her.
She's definitely slimmed. Well, because this is an older photo.
They're all really, really skinny
So
right now.
they've done, and I've always said this. I've said this for years, like last 3 years. Everyone's like, oh, well, like what's next? What's next? I'm telling you, everyone's gonna start getting skinny again.
Yay!
I
My
said
butts
that.
are back
Get what?
in.
Get what?
I was like, people are gonna start getting
but-
skinny. People are gonna start getting skinny, and then of course they just started like last
But
year.
there's an injection.
I know.
That
We
might-
should not talk
There's
about
a
that
skinny injection?
Yeah,
What
my
is that?
couple of my
because
friends are on that.
it's not
Curvy will always.
it's
be
not
in.
promoted. It's not good to promote
It's
it
not
medically.
good. Okay,
'cause
so
it's-
there is no and there's no injection.
definitely nothing that's FDA approved. Yeah.
You know,
Well, so I mean, just from knowing her being in the news, we know she's gotten everything done.
Yes, but she also is one of those people. I would say maybe 5-10 years ago, it was just a little bit too excessive. Like the shaping of everything.
Her waist was.
And I
her
think it was
waist,
a
her
lot
thighs.
of, maybe a lot of shading on the makeup. As
That
well.
too, but also her body. It was just like a lot. And then now, I think in the last 2 years, after having kids and, building her empire like even bigger and better, like she looks really, really
really
I
good.
think she looks incredible.
Do you think she went to the gala like that because she just got like something done?
The gala, like what?
Do you remember she was like in this
the
whole
Met Gala,
black?
the
Oh, I don't think so.
I loved that.
She was covered
Because she
head
came
to
right,
toe
because she was out of
in
it
black.
right after the
But
gala.
the
She was
gala
seen
isn't
right
that
out.
about making like a bold
Statement.
statement?
Yeah, but you couldn't see, you couldn't even see her face. People
Yeah.
had to tell you it was
True.
her under it.
Oh
Yeah.
yeah, I don't.
No,
recall.
she had full glam done before she got into that.
Yeah, I'm sure she did.
Yeah.
Yeah.
She's like completely
Yeah,
done.
just in case she has
Just
to
in
come out of
case.
it. Yeah.
Yeah.
But she
But do
She
you
looks
think,
good.
as a doctor and as a professional, that the work that she's had done looks natural?
I don't think she looked natural before, and I don't think that was her goal. I think she
No,
wanted
no.
to look supernatural, like above average, like really, like she wanted to push the edge.
Yeah.
You know?
Because there's a lot of controversy regarding all of the family's faces and all the work they've had done.
Yeah.
People saying, are you expecting too much?
I think out of
women?
all of them, Kim is kind of the middle ground.
I would agree with that.
Because the other one that no one ever talks about looks like she's
Chloe, I love you too.
No, not her. The other
You're
Kendall.
talking about Courtney.
Kendall.
Courtney. I'm talking about Courtney.
No,
Kendall.
Kendall.
No, Courtney.
Courtney.
So Courtney is probably one of the
She does,
most
like,
natural,
natural, right?
She's
Yeah.
the
more
most natural
natural.
ones. Then I would say of the 3 older sisters, it would be Courtney, and then Kim, and then Chloe's probably had the most change.
Yeah,
Oh,
she doesn't
yeah.
even look the same.
But she also looks amazing.
She looks amazing.
They all
So
start to look
good.
like everybody
Yeah.
starts to
She
look like Kim.
And then of the 2 younger ones, obviously Kendall is less touched up
yeah.
than
Right.
Kylie.
But Kylie looks good too.
I don't know which one's which.
I haven't seen Kylie. No, Kylie's the one that has like the lip
The
billboard
lip.
on La Cienega and Santa Monica. That like
yeah.
the Kylie Cosmetics. And then Kendall is like the supermodel who walks with Bella.
Kendall's
and
the one that
yeah.
has the toothbrush line that
Yeah.
moon or.
Oh, okay.
Kendall has more of like the fox eye, like
Which
the
is-
natural fox
Which
eye.
one's the one that everybody's like, without makeup, she looks like. They made that line that you said, if you don't have money, or
Yeah.
you're not ugly,
You're
you're
not
not
ugly,
you're
you're
just
broke.
poor.
Yeah.
You're not ugly, you're just poor.
Yeah.
That statement is true.
So true.
Which
Yeah.
one was that one? Was that Kendall or Kylie?
I never heard
It was
that.
I think it was actually like all 3. It was like a
Was it
group
all of them?
photo. It was a group photo. But I also think it was photoshopped. Yeah, for sure it's photoshopped. Yeah.
All right.
They've never been ugly. They've just changed a lot. She is 40 now.
She is 40 now, so
So she doesn't get Botox?
she didn't, and then maybe she does now.
I don't know how true that is, but it could be. I mean,
think
I don't
we
know.
need to
I'm not
get
her
s-
doctor.
Get
Well,
someone
yeah, we
on
have
the
to
phone.
fact check this.
Yeah.
Yeah.
I mean, I'd give her the benefit of the doubt. She's had a whole glam squad. Like she doesn't really
Right,
need
yeah.
Botox. I mean, if you
Yeah.
have all those people that can help you, and I also know she had a really good doctor. And it does happen. Like sometimes you don't do well with the needle, and it scares you. Also, she did have how many children does she have now? 2 or 3?
4 or 5
4?
or
Oh.
something.
Yeah, she's got a lot. She's
Okay,
got,
so I'm behind.
I think
but
4. Yeah.
also,
Like
like
4.
while you're pregnant and like while you're breastfeeding and stuff, you're not really supposed to be getting Botox.
Oh, yeah.
So
She didn't have
she shouldn't
to
even
too.
have been getting it for a while. So I mean, I can believe that.
Yeah.
I can believe that.
I know she did surrogate for the last 2 or 3
yeah, that's
kids.
right.
Oh,
She didn't have them naturally.
Oh.
Well, whatever
Yeah.
you call it. I don't know.
That's another story. I don't understand.
But it's not recommended to get it when you're pregnant,
No, I mean, you
or
can't do
like
anything
I think
when you're
even when you're breastfeeding, you shouldn't be you shouldn't be getting it. So
Baby's gonna have.
makes sense.
Why isn't my baby's
Why did your
face
baby
moving?
look like -4 years old?
He's Benjamin Button.
Oh, all right.
Oh, Kelly
Oh,
Ripa.
Kelly.
She's a cutie.
I feel like
so cute.
Kelly. I
I love
can't
her.
pinpoint. I feel like she
Definitely
just looks good.
Botox. There's no way she hasn't.
probably.
Botox,
It's really
but-
like again, it's really hard unless I'm talking to them.
And
Yeah.
she's so
Until, like,
thin.
they
She
have
like
to
has
move.
no fat
No
on
fat.
her.
Nobody, but she's never had it. Like I said, she's one of
Yeah.
those people who's never yo-yoed. You
Yeah.
know.
Yeah, and she doesn't even look like. I think for her, if she had anything, maybe Botox to look and feel fresh, but she doesn't even look like she's ever needed anything. She's always
Yeah.
been
Yeah.
beautiful.
She's always looked the same.
Yeah.
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 She has.
She's gonna be like Joan Cullen.
Oh yeah.
Thing.
Yeah.
She's like that level where she just always looks the same.
It says, when discussing her rationale for using Botox with her then live co-host Michael Strahan, Kelly Ripa shared that people keep asking her, "Are you okay? You look like you're angry." Her response, "Then it's time to get Botox."
See, I
you
love
go.
that.
I like that.
She does. She's cute about it too.
Yeah.
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 Cute. I think
It's
that's
always
funny.
really
Like the
liked her.
people who look the most natural are like the least afraid to brag about it.
Yeah.
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 well, I say own it,
You know?
They're
but that's
like-
just like
Yeah.
how.
But it's
They're, like,
probably because
selling
they
it.
know that they're doing it right. They're doing it the right way,
Yeah.
to look natural and to look as good as possible and not weird or different.
And I think it's important for not all people, but those who are conscious of how they look. Especially a lot of my girlfriends have said to me, "Can you tell me when it's time?" And
yeah.
I'll be like, "It's time because now
you're
you just
asking.
look angry." And it's true that you can get to a point on some faces where you've constantly got that
Yeah.
scowl or the
RBF.
lines are
Yeah.
staying there. And,
I have that naturally.
no, you're real good. You're real good. You don't have that.
The RBF.
What's the RBF?
Resting bitch face.
Yeah, where you just look mad.
Oh, I
People-
love that.
People
Don't you-
think
I would pay for that. You got that naturally. That's why I
got
get.
it
That's why I get
naturally.
Botox.
they're like, you look mean. I'm like, I'm actually.
You can
really
also use
nice.
Botox to fix that. You can lift the corners of your mouth just a little bit.
Heard.
So you're not always frowning when you're resting. Yeah.
I'm going. Okay.
she's
I was saying in a few months, we're all going to be like,
I'm gonna be like, I'm
won't
back this
recognize-
time, guys.
people like,
Fresh
who's that?
Botox.
Did they get a
Like
new
the
co-host?
Kardashians.
Well, she's the end of our champagne hour. We don't have
Yes.
any more.
And
So-
what a beauty to end on.
I
Yeah.
know.
Yeah.
I really love her. Some people hate her. They say that she's like very annoying.
How do you
Really?
hurt? This is like the America's
I
sweetheart.
think
Well,
they're
I
just
think the
haters.
thing
People are
I-
just jealous.
I know.
The
you
thing
know?
I love most about her is her husband.
Who's her husband?
I don't know his name, but he's so
Isn't it
Consuelos.
Mark Consuelo?
He's very good looking.
Wait,
Yeah, Mark Consuelos.
is that it?
Consuelo?
I think so.
And they seem to have a really great relationship.
Oh, I
with
think
Or
I've
is that
seen
a-
him. He is kind of sexy.
It was
huh?
that sports. I'm so bad at
Spanish.
this.
She's like Spanish.
Oh, I know. He was on a lot of soap operas back in the day, right?
Do you think he and her get like couples Botox?
I mean,
They're like,
I don't know if he gets. I think I saw him one time. I don't know if he gets it, but men don't get it.
Men don't really
Men
get
don't
it.
get it
So,
as
like,
much as women do. Men do not get it as much. But you'll be surprised. You will be surprised how many men do get it. They usually just don't get it in the same areas. Like men will usually get it just right here,
So they don't get those
look
lines?
so angry right there, or like the really like the massive crow's feet. They're less likely to kind of like do the whole thing.
it's more prominent here. Like I know, like I'm from Michigan, so I know nobody in Michigan. Any of my
True.
friends, none of them get it.
True, yeah.
Yeah.
Everything's regional, but I
Yeah.
mean, when you're in LA, when you're Beverly Hills,
You're in Beverly
she.
Hills.
Dreams live and die.
Yeah.
Oh, big giggle. Well, this has been such a great hour or so of our lives. And Dr. Lee, thank you for coming and sharing all your expertise and your knowledge and your time. We appreciate you so much. And where can we find you?
Well, thank you for having me. You can find me, the easiest way to find me is just on Instagram. So it's at Dr. Johnson Lee. And I have links to my website and kind of more videos of myself on there.
And it's always such a treat because I follow you on Instagram,
Me
and
too.
I'm like, whoa!
Yeah, some of the
before and
things,
afters.
some of the things you kind of want to prepare yourself for.
I love the ones that says like sensitive,
Yes.
like sensitive video.
I
I'm
warn
like,
you. I
watch.
warn you ahead
I
of time.
want to see it.
I definitely warn you ahead of time.
All right. So, ladies and gentlemen, I'm sure we have a few gentlemen out there. If you enjoyed this and you want to see more of it, this was brought to you by the Skin Research Institute because, like we said, we're trying to get you the answers so you know what's going on, what works, because we don't want you to waste your money on a procedure that doesn't work. So, that said, we want to know what you want to talk about next time. So, go to the skinresearchinstitute.com and sign up for emails. I'm going to be sending out a poll, and you guys can vote on it and have a say in it. So that's all we have for now. We're going to finish this bottle, but we will see you next time.
Thank you.
Cheers. Cheers. Enjoy.
All right.
Who wants free Botox?
I can't drink this.